So 2 other variations you can do is just grab up here. You can also get a towel and wrap it around. I'll show you how to do that maybe another time. Or you can kind of do this where you have them pull your toes towards you.
Just release
and just
the
drop
butt.
your hips. Just drop your toes towards you. Yeah, there you go. Okay, you can do that one too.
Nice.
Okay,
Nice.
my favorite, my go-to really is this one. It is accessible for most people, but some people just cannot handle it. Okay. Okay. Swaying back and forth. Get some elongation. Okay. Look at how I'm shifting. I'm in a squat. Okay, but I'm also using his weight, right? I'm just pulling back.
Yeah.
I'm just leaning in.
You want me to do the arms?
Okay. Not right now.
Okay.
But like you can bring them all the way down. Okay. And then stretch them like this and bring them up. See where their legs go. Okay. If they stay straight, their body is going to this one. Okay. What we're doing here is we're trying to get the legs as straight as possible, body at a 90-degree angle, and we're pushing down on the heels and on the balls of the feet. What this does is it stabilizes his LPHC. He doesn't have to try to stabilize his hips. He can just breathe deeply and he gets a really nice expansion. He's in good alignment without having to use any musculature to support his stability. The ground is helping him. We're helping reinforce it with our weight. Okay. Now some people will go in with straight legs. They'll be fine. Other people, when you pull them up from the previous exercise, their knees will go bent. And for those people, bend your knees. You want to come into happy baby. Okay.
It's making 90-degree angles.
Now, you'll see a lot of things when you do happy baby too. So when I do happy baby, I don't move the legs linearly, okay? Because they will already move linearly if you move them circularly, because the hips are circular and the knee is linear. So I'll actually move this circularly and the rotation will happen in the hips. Make sense? Okay. And that'll reveal some things too. Okay? Maybe their body is needing more crow. And so like with David, he likes it. And you'll see when I do that, he'll go outward like this. And that's telling me that, okay, let's go into more of a crow. So I'll push down here and I'll make like a dynamic crow exercise. Does that make sense? We're not just doing happy baby. He's revealing to me he needs to go like this. So I do that. And some people need to open up a little bit more in the hamstring. Some people like it less. That's less. This would be more. Okay? So you do that. Finish by grounding them. You push down. Always tell them to keep their arms wide or out. David has his arms up. That's totally fine too. Okay? Push side to side. You'll see also this is circular. Look what's happening in the hips. Okay, so try to contour to that. Slowly come out. Go back into the hip lumbar decompression here. You might sway them down. Okay, so I'm gonna start on the traps. Okay, and I'm not gonna touch the actual spine, but I'm going to drag right around the sides. Okay, and that could be expressed in a few ways. You can just like push the fingers in the back like this. Okay, and then just try to find the center here again. But your journey starts to the sides. You come to the center. Okay. So I'm not actually pressing on his spine. Right at his access point, I'm finding his skull. Okay, never really pressing on the actual spine. You don't want to do that. It can really hurt someone. Okay, so you can do that. You can express it like that. You might want to get your thumbs involved. There's a lot of lymph nodes in the neck around here too. You see a lot of people have thyroid issues or inflammation up here. They need a massage like this. Again, I'm trying to create circular motions. You can see my thumbs are moving in a circular way. Same with my fingers. Okay. And then right around here, right at the edge where his jawline is, where his neck ends, there's a lot of tension. You know, because that's a place where the body really has to stabilize. It has to keep his head safe, right? Very delicate. So these muscles are overworked. They'll be overactive usually, and they need some rest. And it's all this tension from his jaw and his neck. You can work into. You really have to dig into these pockets. Okay. Again, move in circular motions, and just feel the contour of his face, of his neck, and just move around it like that. Yeah. So once he's open like that, he has more blood circulation. You might do a stretch. I like to lift up again. I'm not touching his spine. I'm just touching that middle part that we talked about. Yeah. And then I'm pushing this way. So it might be too much strain on somebody to move their neck a lot.
Yeah.
So get their neck to a point that they're comfortable, and then just push
On the shoulder.
Okay? This is a load-bearing part of the body. There's 3 main load-bearing parts that I use in my therapies, which are right here on the shoulders, on the tailbone, and then 2 places on the heel and then the arch of the foot. All load-bearing points.
So
Also here.
are you using you pushing with this
It's more than
hand?
3.
Your right hand?
I might,
Just gently.
but this is more yin.
Okay.
This is more yang.
Yeah.
I'm pushing here, and I might just change his rotation
Yeah.
to find the best spot.
How do you know that? What that is?
You feel it. You feel more resistance coming back. You may feel more heat.
Yeah.
And you do Reiki, you may see some different colors.
Yeah.
You know,
Yeah.
just be mindful of all those things.
So where the
For me,
resistance is.
exactly. For me, I follow where the resistance is. The more he has pushback, the more it's a direction I need to go into.
Gotcha.
Okay, and this translates into other things. So let me show you. You always, if you're gonna bring his neck up, just recalibrate and just get some length in there first. You never want to compromise the length. If you lose the length, you lose the harmony of the stretch. Okay. Now I'm kind of pushing on the top here and then rotating it down. Okay, and that really helps get into the back of the neck. Okay, and again here you might do a little gentle rotation. Be very mindful of any movements that you make. Make them subtle, make them slow. And again, I'm not just rotating too. I'm rotating circularly, and I'm also creating length. I'm rotating and I'm pulling my hand out that way too.
When you
And again, like I never compromise length. Always keep him long as you stretch. Come here. And push that way.
getting all those scalies.
This one's a little tricky, but you know, just kind of get up top like that.
Yeah. Gets deeper into the base of the skull, down to the shoulder blades too. Just deep attachments.
And if you feel comfortable, like if he's in a stable enough place, you can even just kind of get in there a little bit.
On the side of
Yeah.
his neck.
With David, he's a little aggravated on this side. I wouldn't push too hard, but you can, you know, do circular motions, especially with some oil. It's nice. He's really tight here,
Yeah.
really tight. So it's nice to
That's his path.
just move circular motions. Just get some circulation in there, get some life in there.
Yeah.
You might even move into like the edges of his face. Really, that's where he holds a lot of tension. That's the root of the tension.
How do you know that that's the root?
Because it's like it's the edge, right? It's what's stabilizing. It's the root of the connection. It's connecting the neck to the head. You'll see the same kind of thing happening in the arms. Like when people have like tight forearms, it's really, really tight at the insertion point. You know, because that's what's taking on all the stress, all the strain. You know, taking on all the load. And so in the same way, just right around the edges, you'll see it'll be like right here, insanely tight. I don't know if you could feel it. It's tight here, but whoa, it's a rock here.
I feel that when I adjust his neck on that side.
So starting here is important. Paying attention to the root here is important. And then from there you can feel it. You can feel the line of tension. I'm not making this up. This isn't some kind of technique where like you must move your hand this way and that. No, just literally push down and you can feel where he's tight. And like, do you see there? I lost it for a second.
Yeah. Yeah.
And just try to reconnect, to be firm. Don't press too hard. Just be firm enough to be able to follow a line of tension. Okay. Let me show you one more thing for the traps. David, get up. Okay. You're gonna sit up this way. Okay. This is really nice. Again, it's a nice load-bearing part. Okay. David's got a really good posture. He's a pretty avid meditator, but someone has a poor posture. David, can you like slouch for me on purpose? Okay. So if someone has a poor posture like this, okay, don't press too hard on their spine or anything. In fact, if you need a towel or something, if they're asking for that, you give them that. But you start like right below where they start creating that arch, okay? Push your hands here, and you're gonna lift your knee up and forward. And then you're gonna push your arms back. Okay, from here, get your hands up and press into the shoulders. Now, this is a load-bearing part, so you can press as hard as you want and most people won't feel a thing. Doesn't matter how old or young they are. This is very safe. And you see David's just organically starting to move his neck. I'm stabilizing him, so he's getting a really nice stretch in his neck by doing nothing, just by moving his head, just by breathing. Okay. So, a little trick. So you have two types of motor neurons in your body. You have the muscle spindles and you have the Golgi tendon organ. Okay, the muscle spindles contract your muscles, and the Golgi tendon organ releases them. If you press down on any spot, this is like medically proven, huh? You press down on any spot for 30 seconds or more, it'll automatically trigger the Golgi tendon organ to release the muscle. So if you're doing like myofascial release with a foam roller or something, or if you're doing something like this and you hold for 30 seconds, I notice after 45 seconds that, you know, my patients are experiencing a deeper level of relaxation. I can already see like David's shoulders are melting down a little bit. Okay, so if you're going to do these kinds of holds, do them for at least 30 seconds. I recommend 45 seconds just to get a good effect. Once you see his shoulders kind of melt down, it's probably been 30 seconds now. Okay, one thing you can do is like press down on one side and just move his head the other direction. Okay, don't do too much. We already stretched the neck out pretty deep. Okay, so he doesn't need that. We're trying to cool him down. Okay, do the same thing on the other side. Okay, last three that you might want to do. They're super awesome. You know, you might get a tip. Okay. Get his hands back here. Okay. Nice twist this way. And I'll teach you how to do this with resistance stretching too. It's really important you understand how to do assisted stretching, because in resistance stretching you'll pick up so quickly. Again, here I might want to open his chest up, so just rotate him like that. Try to keep the spine straight. Some people will slouch, so that's why I like to keep my knee back here. And just keep them tall. And just do that on the other side with them. Thank y'all for your patience. This next one is my personal favorite. I know David loves it too. Okay. You get to the side, make sure that their spine is tall, and just have them lean down. Put your thigh or knee on their armpit. Okay. Now they're gonna have a tendency to like either slouch forward, or in David's case, slouch or lean back like that. Make sure that their elbows are in line with their ears. The shoulders, elbow, ear. creating a perfect triangle because it's not too far out or anything, okay?
Mm-hmm.
So I might get back like this with him. I'll take my forearm, bring it around this way, and if you want to come around here, I'll just show you.
Mm-hmm.
Side rib cage, push it forward. Take the forearm back, rib cage forward. That opens his heart and chest, and he can breathe deeply. So this is kind of making a full circle. Remember when we did the arm stuff when they were laying down on their stomachs?
Mm-hmm.
Yeah. So during that one, I said, try to feel the side of your rib cage. Right. That's something they gauged. That's something they calibrated in the beginning of the therapy, and it's now something they're calibrating at the end, and they can feel an improvement. So I always try to do that in a sequence. It's like start with something, start with an intention, start with a basic foundational stretch for that area, have them feel it, and then at the end finish with a more deeper expression of that stretch and have them see the results, see the improvements. Okay, let's get you on the other side. Okay.
I feel like I could go deeper.
Yeah. And if we had like another person might push his knee down, just making more points of contact there. Might rotate him just a little bit. Don't want to rotate too much. You're kind of cool.
How hard are you pushing with that hand?
I'm being firm.
Okay.
I'm not
Not really too much.
hurting him. I'm not being soft. Being firm. I'm moving what I need to move without hurting him. Last one I like to do, okay, I think there's plenty of stretches to go over, is get them back here. Okay, you can either, depending on how old they are, if they have blood pressure issues, definitely be gentle. With this one, if they're older, be gentle. But you can bring them back like this. If their shoulders start hurting, if something starts hurting, you might want to adapt and just hook them like this. Okay? And just lean them forward. Head back, David. Bring your head back. Deep breaths, okay? If they want it more intense, this is a more intense expression. Okay, because then you can push the hands back, you push the fingers back. It really activates the whole complex here. Okay, it's a good heart opener. Again, we started in a safe position. We started them on their bellies, feeling safe and protected, and we're finishing with them feeling open and confident, energized and awake, right? So always trying to create that balance in every sequence. And that's it. That's the sequence.